And now joining us via satellite from Washington, D.C. is Dr. Mary Schreiber. She's the president of Guava Home Health Care. Of course, they are a wholly owned subsidiary of Capsalis Corporation. The stock symbol is WELL. Mary, welcome to the program.
It's great to be here, Don. Thank you.
Now, Mary, the home health care business is fascinating. How did you actually get started in this industry?
Well, it all started with a phone call from the hospital where my father was admitted. He had a heart attack, and my father was in Minnesota. I was in Delaware, raising my 3 kids, working full-time, and my world stopped. Dad had a heart attack, needed help, and I needed to fly home and take care of my father. Being the oldest of 5, I found the onus of the responsibility was solely on me. My siblings helped out, but I felt the need to go home and really be with him. And during my journey, I found that it was very, very difficult to find in-home non-medical as well as medical attention. I was putting Dad in the car, taking him 30 minutes to get blood draws. I was driving him 45 minutes to get wound care. I had somebody in the house that was cooking and cleaning for him. Doctor's appointments were 30, 45 minutes away, and it was just a really tough journey. So after his recovery, I went back to Delaware. I studied the healthcare system and what was available out there, and thus I decided to start a business that provided the non-medical and medical care in-home.
So basically that was the genesis of Guava Home Health Care. Tell us now about the company in general.
The company in general, I started the company in 2007 and started as a home-based business, and immediately met it with success because there is such a need out in the community for this type of service. Franchised the concept in 2009, and then met Capsalis in 2010 and took the company public then in 2011.
So basically now the services that Guava Home Health Care provides, they're rather broad in scope, aren't they?
They are very broad in scope with a focus on the geriatric population, but we're not limited to that. We provide pediatric through geriatric care. So we can come into your home and provide pretty much any service that you need, from non-medical to medical. So that is anything from light housekeeping, medication reminders, to wound care, injections. We can provide occupational therapy, physical therapy, as well as a medical doctor coming into your home. So we can do that for geriatric, but also wherever the client resides. If we have individuals in the schools that we need to go see, youth, we can go into the schools, and we can go into assisted living facilities, hospitals, wherever the need is.
Now, what is it about life in America in the 21st century that makes Guava important right now?
Well, currently we have over 35 million people over the age of 65, and that number is growing. Within the next 7 to 10 years, we're looking at approximately 80 million people over the age of 65 that are going to need some type of care. And if you look at the structure and the assisted living facilities and the retirement communities that are out there, we're at a loss. There is going to be a service that is going to be needed out in the community, and we're at the perfect time, at the perfect place.
Guava Home Health Care is a subsidiary of Capsalis Corporation. Their stock symbol is WELL, and our guest has been Dr. Mary Schreiber. Mary, thanks so much for joining us on the program.
Thank you, Don.